Good morning, everyone. I'm Dr. Smita Ingle, Deputy Director for Physiotherapy, Occupational Therapy and Rehabilitation Center, Ruby Hall Clinic Hospital, Pune, one of the biggest hospital of Pune. We have three centers, Sassoon Road, Vanodi and Hinjawadi. Last 2 years, the whole world has been going through COVID and COVID issues. Some of the doctors, medical professionals, nursing staff and all other people, normal public also were suffering from COVID. And our team was busy and involved in performing lung exercises, post-COVID rehabilitation for COVID patients. We designed exercises to improve the lung capacity on our YouTube channel, and lot of viewers has done subscription to our videos. We are happy and glad to see that lot of comments have come up during those COVID period, and people have appreciated those lung exercises. The comments were that they really got benefit after they did these exercises when they were in isolation. So now I have come up with another video with my team, and that is about diabetes. Diabetes, everybody knows it's a very complicated subject, and not too many exercises, protocols are made for diabetes. So after a lot of study and under the guidance of our physician and diabetologist and following the ACSM guidelines, we have come up with some set of exercises for diabetes. As everybody knows, and also the ACSM guideline says, the benefit of regular exercise in individuals with type 2 diabetes and pre-diabetes include improved glucose tolerance, increased insulin sensitivity, and decreased HbA1c. In individuals with type 1 diabetes and those with type 2 diabetes using insulin or medications, regular exercise reduces insulin requirements. Important exercise benefits for individuals with either type 1 or type 2 diabetes or pre-diabetic include improvement in cardiovascular risk factors, that is lipid profile, blood pressure, body weight and functional capacity, and of course well-being. Regular exercise participation may also prevent or at least delay the transition to type 2 diabetes for individuals with pre-diabetic who are at a very high risk for developing diabetes. Let me all share with you that unfortunately I am suffering from pre-diabetic for last 2 years. So I personally feel that I need to do exercise, have my proper diet regime and manage the stress levels, which is another contribution to diabetes. So each and every individual needs to follow a certain exercise principle. For diabetes, FITT principle are the best to design the exercise program for diabetes mellitus for healthy adults, which generally applies to individuals with diabetes, and participating in an exercise program confers benefits that are extremely important to individuals with type 1 and type 2 diabetes. So we were talking about FITT principle. F stands for frequency, that is how frequently we should be doing the exercises. So that should be generally 3 to 7 days in a week. Then intensity. Now in clinical setup or in hospitals, we do calculate intensity of exercise. We have equipments like ergometer. Then we perform 6-minute walk test. Then there are formulas to calculate the intensity of exercises. So usually it is considered 40 to 60% of VO2 max. So it is the maximum rate of oxygen consumption measured during incremental exercises, that is increasing exercises of intensity. So V stands for volume, O2 stands for oxygen, and max is maximum. In other words, the maximum or optimum rate at which the heart, lungs and muscles can effectively use oxygen during exercise, used as a way of measuring a person's individual aerobic capacity. In simple words, 220 minus your age should be considered as your maximum heart rate, or that we call as a target heart rate while doing exercise. Now the simple example for this is like you are traveling on a highway and the speed limit is given 80. So we should be maintaining that speed limit. We should not cross that speed limit while traveling. So that is how while doing exercise also we should be maintaining our particular maximum heart rate and target heart rate for every individual, because everybody's height, body weight is different. So when we are calculating this exercise intensity, we have to consider this aspect that first we calculate the resting heart rate. When we are not doing exercise, we should know our resting heart rate, and when our exercise are over, we should again calculate our heart rate and make sure that our heart rate goes to the resting level. So third principle for exercise prescription for diabetes is time. Now how do we consider the time? It can be 30 minutes for 5 days and 50 minutes for 6 days. So that is from minimum to maximum. So maximum exercise is for additional health benefits. So then there is type. So there are various types of exercises, and the emphasis for these exercises, activities that use large muscle groups and in a rhythmic and continuous fashion. So what are those exercises? Those are brisk walking, spot marching, skipping, jogging, swimming. So in our upcoming videos, we are showing you various types of exercises that we have designed according to this FIT principle, and how to progress this exercise. The progression can be, we consider as like 5 repetitions, then go on to 10 repetitions, then go on to 15 repetitions, and then also increase the number of sets. You can first do first set, then go on to second set, then go on to third set. So it will be again depending upon individual, and this is applicable to individuals who are pre-diabetic and type 2 diabetic without any indications or complications. Of course, all the exercise has to be done after your consultation with the physician and the diabetologist, and they refer you for proper exercise program and consider all your health issues.